Thank you. And what are your thoughts on bariatric surgery for weight loss? Is that weight loss permanent? Is it appropriate for some people? Does it do more harm than good?
The bariatric weight loss, so I don't deal a lot in that data. I know that there's some short-term benefits to that. Garth Davis here in Houston is not well known to the plant-based community as a bariatric surgeon and is aware of the benefits. I do know that he encourages his patients to change their lifestyle. So I would imagine there's some benefit to bariatric surgery for certain people. Again, we have to be very targeted with these therapies. Just like I'm an electrophysiologist, there are some people who might benefit from a defibrillator implant, but I'm not going to just leave it there. And so I think the real harm with bariatric surgery isn't so much the surgery itself. Maybe if someone goes on bariatric surgery, they get some immediate benefit and drastic weight loss. The problem is that they're not necessarily put on the right lifestyle intervention after that. And many of them are encouraged to eat the wrong foods after getting bariatric surgery. What we see, and again, it's a skewed population because they won't come to us unless they have a problem. People who fail, they gain the weight back, or many people have to have correction surgery or the like. So surgery is not always the best choice. So whenever you go and invade the body, that's not always the best choice. Now, sometimes it's necessary for whatever reason, but you want to do everything you can to avoid it. The patient that I showed you in the case 2 example had a BMI of 43. Now, he was a candidate for bariatric surgery, but he lost 73 pounds in just 6 months, and he's lost more since then. So, I don't know, was bariatric surgery beneficial to him? I say in one sense, maybe it was, but not really. There's a therapy that's far greater than bariatric surgery if he only complies with it. So people who are sick or morbidly obese or whatever, they're not morbidly obese because they have a deficiency in bariatric surgery. They're morbidly obese because they have, deficiencies in other things, and that's related to their lifestyle and their mindset. And we really have to address it at the problem. And so that's really the correct. And if we don't do that, it doesn't matter how many bariatric surgeries you do, the problem still exists. And that's the case with the medications. That's the case with bypass and stem. Many people don't know that if you look at the 5-year data for coronary bypass surgery, you're treating people with just chest pain. You crack their chest, you bypass their arteries. Over 5 years, there's no added benefit of bypass surgery than just treating with medication alone. And so doctors still tell patients, well, you need to have the surgery tomorrow, you're going to die. There's no evidence. And not only that, the evidence we have is against that statement, but we still push for these procedures.
Actually, that was my exact next question, was about bypass surgery. So even in acute situations, you don't find that bypass surgery gets you at least past that acute situation, and then maybe the 5-year outcome may not be that great. But if someone came in and really had like something acute going on, bypass surgery wouldn't be effective.
So that's a great question. So I've been in a lot of situations, acute situations, patients acutely decompensated, middle of the night, catheter, they're decompensating. There are situations where patients will benefit from bypass surgery. I'll give you one situation. A patient I treated back in the year 2000. He's still a patient of mine now. He came in, a heart attack, massive heart attack, catheter in the middle of the night, multivessel coronary disease. And while I was in the cath labs, his hemodynamics changed. I think then, looking back, he ruptured his papillary muscle. I was doing different angles of the camera, and I saw the hemodynamic profile change. Aborted the procedure, called the surgeons. He went into OR, bypassed the surgeon. We did a TEE, a transesophageal echo. We saw that one of his papillary muscles had ruptured, and he had a flail mitral valve. They had to go back in and do an emergent mitral valve replacement. He had a very, very high mortality rate at that time, and he survived. He was in the hospital for a long time, had a stroke, et cetera. And we worked hard and managed him, got him through that. He eventually needed a defibrillator, et cetera, et cetera. We're now working with him on a plant-based diet. So this is 23 years later. The long and short, in that situation, surgery was indicated. He had multivessel disease, a ruptured papillary muscle. He was acutely decompensated, et cetera. Now, there are other situations of people who are acutely ill too. They are having a heart attack, they're acutely ill, and the surgeon will come in and says, I'm not going to operate right now. Patient's too acutely ill, stabilize them first, then I'll operate. So it's not always that you're going and operating in an acute situation when somebody's unstable. I've had a patient where, he came in, he was having chest pain, and of course he left the hospital AMA, came back in 24 hours, heart was beating less than 30%. He had multivessel disease. The intervention said, it's not indicated for intervention. The surgeon said, let's wait, cool him off. And so there he was in the throes of a heart attack. And what I do, I put him on smoothies and super green smoothies and E3 Live and got him better and got him out of the hospital. So in that case, he was too sick for surgery, too sick for angioplasty. So what was left? Green smoothies. So the point is that, every case is different. The answer is, generally speaking, yes. When somebody is in the acute throes of a heart attack or acutely decompensated, you put all your marbles on the table and you say, okay, here's what's going on. Should I do this? Should I do that? Should I do whatever? But one of the marbles that I definitely think needs to be on the table is the marble of detox. I had a patient had a cardiac arrest in my office. He was sitting in the waiting room, went out, VFib arrest. We got him, did CPR, shocked him out, got him back. He was awake and talking by the time the ambulance arrived, sent him to my hospital, sent him to the cath lab, did a cath, no coronaries. We set him up for a defibrillator implant, but I had him on a raw detox in the hospital. So all of these things should be done concurrently. It's not just because we have to do surgery, don't mean we forget about the raw detox. Don't forget about the time restricted eating. In fact, these are the patients who need it the most. So yes, someone who's acutely decompensated, surgeries and interventions should be strongly considered. They're not always indicated, and sometimes the surgeon will say they're too sick. But that's where you need an aggressive lifestyle intervention, raw detox, time restricted eating right there in the hospital. That's I've shown you a little bit of our studies, but we saw the inflammatory process, it starts to turn around in hours, probably. I don't have data showing hours, I know days, but clearly within day 1, 2, and 3, that patient is getting better. And I know that. I've had patients intubated on life support, and we turn them around, they walk out. That's not every case, but we know that this impact can have a very strong favorable impact. This therapy, I should say, have a very strong favorable impact on patients, even who's acutely ill. So yes, you should consider surgery if someone's acutely ill, but you should not do surgery outside of an acute nutritional detox intervention also.
Thank you. So in the first season of your show, you kind of said you want to get people back to their former athletic peak. Now, most people weren't, professional athletes and don't have, a former athletic peak. What they are concerned about is their sex drive.
Yes.
How does lifestyle intervention increase sex drive? Can we maintain our sex drive as we age?
Yeah, I mean, that's part of your championship too, right? So the answer is yes, you want to get there. A lot of people are affected. I mentioned the toxicity in our lives. And so that's one thing we overlook in every aspect, whether it's a poor sex drive or diabetes or whatever the case is, your libido, your mindset. All these things are because we're just sort of, laden with chemicals. And so the answer is yes. And that's why we take this approach. We're going to show how we're going to start to measure for toxic chemicals in the blood and xenoestrogens and all these things, which are throwing your hormones off and so on. And so that's what's happening to all of us in this society, is that we're all, it's sort of like, you got this rain and everybody walks out, you don't have a raincoat, we all get wet. The toxin in our water, our air, et cetera. And so this is where we have to look and clean the body out. So it starts with a different mindset, and then it goes from there. But yeah, sex drive, but also it's also your mindset. Maybe you're a championship teacher or you're a musician. So everybody was a champ. Somebody was a lawyer. I mean, we're losing our cognitive decline. Our sex drive is lost due to cognitive decline and other types of decline. So all these things need to be looked at, not just your time in the 40-yard dash, but other, and we expand this concept throughout. Because in season 2, someone asked, well, I wish there were women in it. And I did point out this is a select group. Season 2 is heart disease in women. We got women from different walks of life. A woman from an Eastern Bloc European society moved to Houston with illnesses on the East Coast, a school teacher, a judge, local, with people with all sorts of ailments coming in and different walks of life, and they bring in their different stories related to their illnesses. And so we address those too. Season 3, we may deal with either couples or people with diabetes, or there's some season we'll probably deal with children. So we're going to cover different walks of life and different stories, because it affects all of our stories are different, but at the same time they're similar. And
Sure.
so yes, we'll address all of that.
Okay, so go back to sex drive. How would you suggest? You mentioned detox. Is there anything else that you would recommend for maintaining sex drive as we age?
So we use, and it depends, and what we do is we measure hormones, we measure different things. Let's say for the men, let's say your testosterone levels are low. Well, there's a good chance you may have a low zinc level, because many people are zinc deficient. Lots of men are getting testosterone injections and they're not having their zinc levels measured. Or maybe your coenzyme Q10 levels are deficient. And so there are certain things that's the targeted micronutrient supplement. So sometime by just simply taking 30 to 40 mcgs of zinc a day, you can start to correct that. So it's that's just one example, but that's the whole process, stepping back and looking at the whole patient, not just targeting what the symptoms are or what the abnormal number is.
Thank you. Our next question is coming from Cheryl. Cheryl, please ask your question and let us know where you're from.
I'm from California. Dr. Montgomery, thank you for your amazing work. I think you're a genius. And my question is about raw diets. You've been talking about putting your patients on a raw diet to treat their illness, but do you also recommend a raw diet to prevent illness? And I'd really like to know, do you follow a raw diet?
So I go on periods of eating a raw diet for I did a raw diet for 2 years straight. I'll go on raw plant foods for like 6 months at a time. I'll add some cooked foods to it. And it all depends on your health condition, your desires. We strongly recommend that people are on a high raw diet. And sorry about my lights flickering. On a high percentage of raw foods. So you want to eat a lot of foods that are not a processed. The benefit of a raw diet, certainly when you're starting a nutritional detox, is that it helps you change your taste buds more rapidly. That's one. Two, when somebody's coming off the standard American.
Oh, there you go, doctor. All right. I have no idea if you
apologize. I lost power. I think there's some guys doing some electric work. I may be on my backup generator, but it takes a while for that to kick in. So I think I was talking about raw diet. I'll just quickly address that.
That'd be great.
The raw diet we like to use early on, and it's very effective. It gives us a rapid change in not only the biomarkers, but it helps the individual change their taste buds. It also creates a level of difficulty up front that allows them to comply more easily when you add some cooked foods to the regimen. But consuming foods that are close to raw, that are minimally processed, if you think of it on the spectrum, you get some broccoli and you just pull it out of the garden and eat it, it's going to be at its peak amount of health. You can steam it for a couple of minutes, maybe it's okay. The longer you steam it, the more nutrients it leaves. If you broil it or fry it, I think it becomes toxic at that state. So there's a spectrum of food preparation that you can go through and you lose nutrients. And we do know that there's certain enzymes in cruciferous vegetables that are damaged if you cook them. And so there's evidence that really strongly supports a raw diet. Everybody can't do it indefinitely. It's not practical, but you can certainly do a high percentage of foods that are raw, and we certainly support that.
Great. Doctor, thank you so much for all the information that they shared. It was so informative. I personally will be checking out your series Heart and Soul of a Champion, which is available at heartandsoulofachampion.com.
Yes, soon to be on Amazon. We're working on that, but we decided to release it. We just released it March 18th. We released it on a private platform, and it takes a while to get it on some of the more public platforms. So it'll be on Amazon probably in another month, but don't wait for that. Go to heartandsoulofachampion.com. It's in the chat. If you can share it in the emails, that'd be great. I'll also email it to Steve if he wants to share it with the group as well.
Great. Thank you again so much. If we can unmute the audience.
Broadcast.
It was amazing.
Thank you so much.
Thank you so much. It was awesome.